Hello and thanks for joining the MPlus Master series. At MPlus, we know that the right information can be hard to find. That's why we're here to connect you with the finest experts in the area. Today, we're here with the Director of Premier Spine and Sports Medicine, Dr. Ruby Kim.
So after you're in a car accident, a lot of patients are in a lot of pain and they don't really know what to do. They're stressed about so many different things, from their own physical pain to their car problems, to the bills, to how to get to work on time, pick up their children. So their brain kind of goes like haywire, trying to figure out and connect all the dots and make sure their lives continue on without too much interruption. What they forget about is sometimes their own pain and their own problems and what they need, because if they are not well, then nothing else is well around them. Instead of calling X, Y, and Z, the first thing that comes is the ambulance. And the ambulance wants to know, are you okay? Do you have a headache? Maybe you have a whiplash headache from the accident. Maybe your neck hurts, your back hurts, maybe you broke something. So the fact that the ambulance comes first on the scene tells you right away the most important thing is you yourself, and you need to take care of yourself. All the other things that you're worried about can only happen if you're well. So I want the patients to remember that they need to take care of themselves first. So the first thing after the ambulance takes you to the hospital, or you say, I think I'm okay, I'm gonna see the doctor, is to call the doctor, is to find a pain doctor like myself and see a physician that is going to know right away what's wrong, be able to get you the x-rays, be able to get you the medications you need. Maybe you need a muscle relaxant or anti-inflammatory medication, and really get you going in the right direction so that long-term you quickly get better rather than delaying care. Because a lot of times we're seeing that patients come late and they've had this pain for months. And now the longer you've had pain, the larger the problem, the much more difficult it is to treat the patient. And they come in after months of having pain saying, I've tried this, and this, and nothing's worked. And I'm like, who's the physician who's taking care of you? And they don't have any. And so that really hurts me to see that there's nobody actually directing where their care is going, and that they could have gotten better so much quicker if they had seen us sooner and gotten the right medications on board, or right treatment on board, or even gotten the correct, getting a CAT scan of the head to make sure there's no bleeding or problems in their head that's causing the headaches. I really want people to remember not to forget themselves, but to remember to call us first as physicians, because we're here to help you so that you can go back to your life before the accident. Of course, so it's very important to see your doctor first, right after you get hurt. I was explaining that the number one thing is if you are well, then everybody around you will be well as well. So you need to see your doctor first, and once you see the doctor, then you can start taking care of all the other ancillary things. What people forget is, oh, I can come later. This is more important. My car is more important. The money-related stuff, the legal stuff, and that is all important. But that's only going to come into place if you are well, if you are able to make the proper decisions for your own body. So I would say the minute you got into an accident, while you're sitting there in the accident, the ambulance is here, call your doctor, make an appointment, say, I just got into an accident, can I see you today? And of course the doctor's gonna say yes. They're not gonna say, no, you got into an accident, you can't see me today. So of course we would see you the day you got into the accident. And then from there, while you're taking care of your body and you finally have reassurance that you got the medications you need, you got the therapy you need, then you can start thinking about all the ancillary things that need to be taking place, like where to get my car fixed, where was it towed, which lawyer to call, who's my insurance company. So all those little ancillary details don't need to necessarily come first. I think most important is for you to focus on yourself first before you bring in the other ancillary things. Yes, so unfortunately, people who do not come sooner to see the physician, they often have too much inflammation. They have too many problems. Their problems have only worsened. The way I describe it is that if you have a simple paper cut and you just leave that paper cut, it gets red, it's inflamed, and something that was so minor and so little that if you had quickly taken care of, you forget you ever had it. Now it's becoming very painful. You don't want to use that hand more, you want to use another hand, you start to baby it. Then the skin even starts to change color. So there's a lot that can happen with inflammation. People forget that the sooner you take care of it, the sooner the problem goes away and you go back to enjoying life. So in that same regards, because that's something physically that we've all dealt with, it helps to know that in the same way inside your body, your spinal nerves, your ligaments, your muscles, your joints, they all need to be taken care of early on so that it doesn't develop into a larger problem that needs surgical attention. I think when you go see the pain management physician, you just want to really share everything that's bothering with you from your head to your toes. It's very hard to add on a problem later. Some people are like, oh my gosh, it's just my neck that hurts, really my neck. But then when you examine them, you realize that there's actually other things that are bothering them. When you examine them, oh, my shoulder hurts, my knee hurts. But they're not focused on that. They're just focused on the area that hurts the most. But unfortunately, the way car insurance works is that whatever you had from the beginning is really what you're able to work with. So that's why we do a very thorough job in the beginning, just to make sure that we're capturing everything that the patient may have or will most likely have, given that they were in certain types of accidents. Because we see so many patients who were in accidents, it's very common to see what's common after such an injury.
If you have questions for Dr. Ruby Kim regarding her pain management practice, be sure to leave a comment below. Thanks for watching, and don't forget to like and subscribe to Mom and I TV so you never miss a video.